Today we're going to be going over metabolic acidosis and metabolic alkalosis. What does that mean? Metabolic acidosis is when your pH level is below 7.35. Metabolic alkalosis, on the other hand, is when your pH is above 7.45. Normal pH is 7.35 to 7.45. That's a lot of letters and numbers. What do those actually mean? pH is your acid base balance. This is meaning that when there's too much acid in the body, your body's going to be acidotic, meaning that you're below that 7.35 level. When there's too little acid in the body, you're going to go alkalinic, which means that it is above 7.45. Now, how is this acid created in the body? Well, through the creation of CO2. Acid follows CO2. How do we create CO2? Movement through the body. Whenever we exercise, we create CO2, therefore acid's going to follow. That's not the one that we're going to focus on today, however. We're going to focus on metabolism, which is the breakdown of foods that also creates acid in the body. Now, how is this acid that we built up through carbon dioxide, through metabolism and everything regulated? One is through breathing, which is that creation of the CO2. Like I said, we're not going to get into that today. That is respiratory acidosis and alkalosis. We're going to focus on the creation and regulation with bicarbonate. Bicarbonate regulates acid. It's called HCO3. So coming over here, when we have metabolic acidosis and our pH is below that 7.35 level, we have too much acid. That means that we need more bicarbonate to regulate our acid levels. When we have metabolic alkalosis, on the other hand, the pH is too high, above 7.45. We don't have enough acid. That means that our bicarbonate levels are going to be a little bit lower. Bicarbonate is made by the kidneys. Kidneys play a vital role, and we'll get into that on the PT implications. So how's this diagnosed? You're going to look at the chart and you're going to see the ABG counts. If your ABG count is below the 7.35, we have the acidosis, and above 7.45, the alkalosis. What's going to cause either of these things? Acidosis could be caused by sepsis, be caused by chronic diarrhea, because if you think about it, your kidneys, they're losing too much bicarbonate. Kidney disease, that's why the kidneys are so important. We can't get rid of the acid because we don't have the bicarbonate made anymore. Diabetic ketoacidosis, it's in the name, acid there. And then ingesting acid and stuff as well. Too much acid, that's going to cause that level to be too low. Alkalosis, on the other hand, we're going to have acid loss from vomiting. Low chloride increases the bicarbonate in a way. Hypokalemia, which is too little potassium. High aldosterone levels, and then too much IV sodium. So your patient presentation, depending on whether it's acidosis or alkalosis. Acidosis, they're going to have deep and fast breathing. It's called Kussmaul breathing. That's more so with the respiratory acidosis and alkalosis, but the same thing can still apply to the metabolic side. They might be confused, weak, have low blood pressure, and then potential cardiac arrhythmias because they have changes in their potassium levels. Alkalosis, opposite on the breathing. We're going to have slow and decreased breathing. We're going to have bradypnea. We're going to have abnormal heart rhythms, again, because the potassium levels might be messed up. You can have tetany, muscle cramps, you might be tired and irritable. Now, getting into the actual PT implications, based off those patient presentations, we're going to be monitoring the breathing rate because it's going to change, right? Trying to make up for those acid levels. We're going to monitor cognition, make sure that they're feeling okay for the day, monitor the heart rhythm because we talked about those changes might happen. We're going to be aware of dehydration due to vomiting like we talked about. Patient might feel very weak. And we're going to recognize that this can happen with renal disease. Whenever you do see someone with renal disease, know that this could be a potential thing that happens. And if you do suspect this, alert your RN, supervising PT, whoever it may be, for blood work, which is going to be those ABGs that we do. Thank you very much.